We are going to be doing a project on influenza, and it's Georgia, Becca, and Carla that's working on it. I'm sure a lot of you have heard about influenza, as it's also called our common flu, and we are going to go into detail about what you should expect when getting it, how to treat it, how to tell what it is, and all sorts of different things that are very handy to know because it is quite common.
Influenza, commonly called the flu, is a viral infection of the respiratory tract. There are many different flu viruses that have been identified, and there's new strains that appear each year. Influenza is the cause of millions of lost workdays each year. Young children, chronically ill patients, and older adults are at an increased risk for complications and even death from influenza because of compromised immune functions. How is it transmitted? So influenza is easily transmitted by droplets from coughs and sneezes of infected people. It may also be transmitted by physical contact with a person or object that harbors the virus. So that could be from shaking hands, opening a door after someone else, or sharing a writing utensil. The most effective preventative measure is to get the yearly flu vaccine, which is effective for 4 months after receiving it. Other preventative measures include practicing frequent hand hygiene with soap and water, as well as hand sanitizer, avoiding people who are affected by influenza, covering your mouth when you cough and sneeze, avoiding touching your eyes, nose, or mouth, and practicing other good health habits, and that would include washing frequently touched surfaces.
Anyone can get flu, even healthy people, and serious problems related to flu can happen at any age, but some people are at high risk of developing serious flu-related complications if they get sick. This includes people 65 years and older, people of any age with certain chronic medical conditions, pregnant women, and children younger than 5 years. It has been recognized for many years that people 65 years and older are at high risk of developing serious complications from flu compared with young, healthy adults. This risk is due in part to changes in immune defenses with increasing age. While flu seasons vary in severity, people 65 years and older bear the greatest burden of severe flu disease.
I'm going to be talking about some of the signs and symptoms that you may experience when you get influenza. As I'm sure you all know, it starts off with a sore throat, which turns into a dry, hacking cough, which is a telltale sign that you might have influenza. Another telltale sign that you may have influenza is when you have a fever. A fever can range anywhere in between 37 degrees and 38 degrees Celsius. This is a very good way to distinguish whether or not it is a cold or the flu, because the fever is very present with flus typically. Another sign of the flu is having chills. This is a common thing to have when you have a fever. Sometimes your body just is trying to regulate its temperature and has a hard time doing that. So it kind of bounces in between having chills and having a fever, which can cause sweating. So I've provided this chart so that you can clearly see the signs and symptoms of a cold compared to a flu. The cold are typically more gradual, flu's abrupt. There's usually a fever and aches with the flu and barely ever with the cold, so you can have a look at that and see which are really prominent in the flu compared to the cold. I'm now going to talk about the treatments that you can use if you get influenza or the flu. So the first and easiest one to do is drink a lot of water. If you're not able to drink water, then it's important that you go to the hospital and get either a bolus or IV fluid, because it's very important that you're hydrated to fight influenza. The next treatment that you can use is acetaminophen or Tylenol or ibuprofen. Depending on your symptoms, if it's more inflammation, then you would probably want an ibuprofen, but if it's more pain and aches, then acetaminophen would be a really good option to help treat influenza. Another very important factor in treating influenza is to rest. It's very important to get at least 8 hours of sleep a night, and if not more if you have time off because you're not feeling well. This is a very important way to let your body regain its strength and re-energize and fight off the flu. I've added in a little chart here of 7 ways to fight the flu. So there's a lot of ways to prevent and fight off the flu. The first one, of course, being your flu shot that you get yearly, washing hands, especially during flu season, stop smoking, don't touch your face, eat healthy, good personal hygiene, and of course stay home if you're sick because you don't want to spread it.
Here are some possible nursing diagnoses for influenza: ineffective airway clearance, ineffective breathing pattern, hyperthermia, acute pain, and deficient knowledge. The expected outcome will be the patient will maintain a clear airway as evidenced by clear lung sounds and ability to cough up secretions. Fun fact number 1. The word influenza is the Italian word for influence, and it refers to the cause of the disease. People believe that the planets, stars, and moon influence the flu. The word influenza was used for the first time in English in 1703. Fun fact number 2. The flu can actively live on surfaces. According to the CDC, the virus can live on some surfaces for up to 48 hours, so routine cleaning, disinfecting, and proper hand hygiene is highly recommended to reduce the spread. Anything you frequently touch can be a threat. Fun fact number 3. There have been 4 major epidemics in the last century: the Spanish flu, Asian flu, Hong Kong flu, and swine flu, which caused 12,000 deaths worldwide. The Spanish flu caused the highest known mortality rates from influenza-related deaths, up